Welcome to preschool children. If you're fortunate enough to get to take care of these children, you're going to have a good time. It's a laugh a minute. This age group is 3 to 6 years. So preschoolers, we always start with their height and weight. So for preschool, let me get it. They gain 2 to 3 kilograms per year. They grow 6.5 to 9 centimeters, or roughly 2.5 to 3.5 inches per year. And we start noticing their fine and gross motor skills improve. Their vital signs, vital signs, they start changing again. And the systolic of their blood pressure is like 90 to 110, and their diastolic will be 45 to 70. Their heart rate is starting to slow down, 80 to 110, and their respirations are more like an adult, 20 to 30. So everything slows down and their body systems begin to mature. Their gross and fine motor development also are maturing. We can see an increase in their hand-eye coordination, and when they walk, they're no longer clumsy. Their fine motor skills are usually right on. They can color, stay in the lines, they can stack. By 4 years old, they should have all their teeth. So here's our gross motor skills of the preschooler according to age groups. Some of them that are really typical that you get questions on often is what age can ride a tricycle? Or what age can catch a ball, or what age jump ropes. For some reason, that is those are the more common questions that I've seen on tests. So the fine motor skills of a preschooler, you can find most of these on your Denver development test, and a lot of these you're going to do when you do your Denver development test with children. Most common is, can they copy a circle? Can they imitate a cross? And we always look at how they are holding their pen or crayon, that they're not using the fist of a small toddler. So Dr. Piaget calls us again, as we talked about before, the pre-operational phase, and it transitions slowly into intuitive thoughts, but right now pre-operational. And what it says is it bridges them from being so egocentric behavior until they understand more social graces. So it's not all about me. He's trying to bridge them out of that way, but it is about me. A 4-year-old, which is in the preschool, is a real good age to say, like, how would you feel if somebody stepped on your toes? And they start understanding it isn't all about them. I love their speech. They repeat to hear oneself only communicates about themselves. They still are saying, I do. Anahism is where they give qualities to inanimate objects. It begins in toddlers. It begins at 3 years old. So they might want to say that their kitty needs to eat dinner with you and set them at the dinner table. Magical thinking. Magical thinking are thoughts that can cause an event to happen. They'll believe that they can cause things to happen. Your book also talks about centration, which focuses on one aspect instead of the whole. So, for instance, if you're having a party and the child knows that they're going to have, party favors, they forget all about the party and they just can't wait until they get their party favors, because that's the whole reason for the party, of course. And time. They understand sequence of daily events. They understand really well that they get up and they brush their teeth and get dressed and eat and so forth. They understand on a daily basis sequence, definitely. So their language development is written out here. And remember, we should be able to understand a 3-year-old. Before 3, you might have to have some of the words translated to you. But at 3, they should talk clear enough that you can understand it. They enjoy talking. And as time goes on, as they get older, they'll speak in 3 to 5 word sentences. Dr. Erickson says that this stage is initiative versus guilt. And so they might initiate doing something, but if they do it wrong, they may feel guilty. So this is not a good age to put these children in competitive sports, such as t-ball. 6 years old might be the beginning that it's okay, but not before then. Because if they don't succeed or excel in it, you could actually do some damage to this child. And they may remember it once they do the negative aspect of Erickson's stages, they usually stick there. So instead of going on then to the school age, Erickson and stage, they may stay right here at preschool age forever. So keep that in mind. They are great at learning right from wrong. Sometimes, when they misbehave, they'll feel guilty. So they're really going to work hard not to feel guilty about it. For their self-concept, they feel good about mastering skills, which promotes independence, such as, when they come to the office and they're 4 years old and I can see that their shoes are on the wrong feet, I go, oh, did you dress yourself today? And they're so proud that someone noticed they dressed themselves today. Sometimes when things aren't going well for them and they're stressed or they're very sick, they may regress. We may see them wet the bed or begin sucking their thumb. So if a parent dies during this time, they may feel that because they were naughty, this parent died, and they may have a lot of guilt, and you may see them beginning to suck their thumb. This is an age where they recognize differences in appearance. They begin to compare themselves to other children. And intrusive experience such as cuts or injections are traumatic due to poor understanding of the anatomy. So for instance, if you have to draw this child's blood, you don't want to say, I'm going to take your blood, because they're going to think you're going to take all their blood and they're going to be left without blood, and they know they need blood to live. Early preschoolers take action based on the result of rewards or punishment. Social development. For older preschoolers, they will take actions to satisfy personal needs. I do this, so I get that. They begin to understand fairness. They have prolonged separation. If they have prolonged separation, they may begin separation anxiety all over again. So if they're in the hospital for a long period of time, they may become very anxious. Favorite toys and appropriate play should always be used with this age group to teach them anything. They usually don't have a lot of stranger anxiety. They trust everyone. And this is a great age for pretend play, but they may develop imaginary friends. Usually that's from 3 to 4, and it really should begin to subside after 4. But it's really cute. They'll want to set a table space for their friend who's coming. They might talk to you about their imaginary friend. This is a great age when you have to teach them about a procedure to go get a stuffed animal or a doll and to show them, and then let them give you a return demonstration and let them play with it. Let them play with your stethoscope. Let them play with the syringe without a needle on it. This age group loves pretend play, and they learn from pretend play. So this is an ideal age for teaching them. They should be allowed to question and give their opinion, and it's your job to teach them right from wrong. Sexuality. Preschoolers, understand sexual identity. And at this point, this goes along with Freud, they're going to have a strong attachment to the opposite sex parent while identifying with the same sex. So they want to be daddy's girl, and they'll do everything that mama says in order to be daddy's girl. Fix my hair pretty, mommy. I want to be daddy's girl. And the same thing with the boys. By the way people raise their children and what the children see and they imitate is the way they learn about their own identity. They're still picky eaters at this age, unfortunately. They're not as bad as the toddler, but they still are picky when they eat. They are eating a little bit more than they used to. And in fact, one of the books you have says that they actually consume half the amount that an adult does. They need their protein each day, and they need 5 servings of fruits and/or vegetables a day. They're usually by 5 years old more willing to try different foods. They need a diet that's adequate protein, calcium, iron, and folate, along with vitamins A and C. We should never allow them to consume sugary drinks or beverages. We need to encourage dental care. The eruption of primary teeth is finalized. This is an age, now that they have their teeth, parents need to be the one assisting and supervising brushing and flossing. These children should not be on their own for taking care of the teeth, just as the same as toddler. Parents need to do the work. They can have their own toothbrushes and do it first, and the parents follow up. And if this is started when the child's young, like a toddler, they're not going to give you any trouble doing it later on. Dental trauma is common because they fall, they play hard and they fall. And if you see a tooth that looks a little dusky or it's knocked out, they really need to see a dentist immediately. It's not something that can wait. Sleeping, they require about 12 hours of sleep per day. Some still use a nap time, some don't. And sleep disturbances are common. Sometimes they have trouble going to sleep, and that's sometimes the kids that take naps, I think. But their little minds now are rolling really fast, and sometimes they get excited just before bed, and they have trouble going to sleep. Sometimes they watch a movie that might frighten them or a book. Night terrors are different than nightmares. Night terrors start usually 2 to 4 hours after the child's asleep. And he starts screaming and carrying on. Sometimes they'll sleepwalk, and they're really not awake. So they might start screaming, "Help me, help me!" And you say, "I'm here to help you. Help me! No, no, help me!" They don't hear you talking back to them, and it happens when they're either hungry or stressed or sick. So we might see these in the hospital, and it's usually, as I said, 2 to 4 hours after they've been asleep. They're usually pretty early in the sleep cycle, whereas nightmares are usually later in the sleep cycle, just before the child wakes up. A nightmare the child will talk about and remember. A night terror the child will not remember. Kids that have night terrors generally are the same kids that later on talk in their sleep and walk in their sleep. Okay, hospitalization. They may have a lot of fears for hospitalization. Remember, they have magical thinking. So they might think that you are taking all their blood, or they might think something bad's going to happen to them with this surgery they're going to have, like their chest is going to open up on its own. So they might be imagining a lot of things that aren't happening. They also might fear that they are the ones that are causing it by being naughty. They can misinterpret words, as I said. So don't use words or phrases that we use regularly. I'm going to give you a shot. Well, what do they think a shot is? maybe a shot is from a gun, you have to be careful and explain it in their terms. They do have fears of bodily harm. Giving them a shot would scare them. Having surgery will scare them. So this is where your play therapy is so important, to show them. And even little peers in the hospital that have had it done are really, it's really a good idea to have these kids meet them and see that they're fine. Remember, they cannot describe their symptoms. So we have to go along with how they're acting and what their family says. They still have strong separation anxiety, and many times they feel that hospitalization is a punishment. And the nursing interventions for hospitalization is to explain all procedures in their terms. Use play therapy, allow them to touch the equipment. This is the age group that sometimes the surgeons will allow them to have a tour of the operating room, or really most often is the post-op room where they're going to wake up. So the pain scale for children is pretty cool. So we use faces most likely for this age group, for preschoolers. And what we do say, pick the picture that relates to your pain. So you're having some pain. Is it this guy with the frown on his face, or do you feel like crying? And usually faces is the best way to go. This is called faces. The outer scale is sometimes used as well. The outer scale is pictures, I believe, of 6 little children. And they have outer scales for all nationalities and ethnic groups. It's pretty cool. They boys and girls. And you put the photos down for the child to handle. And then you tell them to pick the photo that their pain feels like. So if they have the child crying, I feel like crying, for the pain. Show them that, 1 is no pain at all, no hurt at all, and, 2 is a little bit more hurt, and so forth. And then you want them to show you which one they feel that they're at. Because they're egocentric thinking, they don't quite get death. And remember that magical thinking might make them believe that they caused someone to die. And so we have to be really careful. And we have to be careful at what we say. Oh, grandma went to sleep and didn't wake up. Well, now, do you think they're going to go to sleep anymore? I mean, you say stuff like that to these poor little kids. So they actually view death as a punishment for bad behavior. And so we don't ever want them to hear you say, oh, I could kill you for that, or I could shoot you for that. They're already, freaking out over it. So be very careful with your words and actually talk to them. So, you're talking about maybe someone else dying at that point, and you could say, so what do you think about death? I have a grandma that died, and I didn't quite understand it. What do you understand? Or worse, about their own death. They think they're going to die. They might have a terminal disease. And generally speaking, we don't tell preschoolers that they're going to die. And parents don't either, because there's always hope. But if they get wind of it, they may think that they did something really bad. One thing about preschoolers, the young preschoolers, they think death is temporary. And they think that, somebody's on vacation and is going to eat and sleep and everything's going to be fine. And eventually they're going to see him again. They're just not going to see him for a long time. Because you know how adults say, oh, you're not going to see him for, for a long, long time, maybe until you're in heaven. Okay, they're probably on vacation in Hawaii and I'm going to see him in a month. As they get older, 4, 5, 6, they might be fascinated with death and want to know everything about it. And they may have a lot of questions. Remember to always be honest when you answer their questions. Here's the immunizations for our preschooler. We sometimes call these our kindergarten immunizations. And remember, safety first. I wrote down about the car seat or a booster um, until a child is like 8 to 12 years old. Woo! Remember, this is the age group that needs protective equipment for everything. They are very interested in firearms. They need to be locked up. Teach them injury prevention. Teach them about walking in front of a car, walking in the street, what they do if a ball goes in the street, what should we do? Take care of them, don't let them get burned. Fire prevention. This age group is very, very interested in fire. So keep matches away from these little kids. And again, keep the poisons out of reach. So, this is a nurse really distressed. Today she made up a song about poo. What happened to me? I used to be cool. It's so true. You start taking care of these little guys, and many times you say the silliest things just like they do. So, enjoy your preschooler. They are funny. Always have a joke that's age appropriate for them because they'll get it and they'll love it. And they may have a joke for you.